Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. As many of you have been following our program, one of the things that we've been talking about very consistently over the years is how we can find affordable ways to take care of our health. You know, everybody who comes into office always seems to believe they have a plan, but nothing ever seems to change. Insurance companies get wealthier as the profit margins get wider, and the people paying for the health care seem to pay more out of pocket and get less and less for their money. Well, now Obama's in office, and we keep hearing about Obamacare, and it seems that what they're trying to push for is a way that the IRS can strong-arm American citizens to be sure that they get the health care that they believe that they want. We're going to find out what's going on here and what is actually happening behind the scenes, both on the pro and the con side of this argument, as we welcome to the Beyond 50 radio program today our guest, Dean Clancy. Dean, thank you for joining us here on the Beyond 50 radio program.
Oh, it's my pleasure.
Now, first let's talk about, for the listeners, what exactly Obamacare is.
Sure. It's a law passed 4 years ago, March of 2010, that purports to reform the health care system of the United States. The core of Obamacare is a mandate that everyone have health insurance as defined by the government, and that mandate is about to finally take effect. There's been a transition, a 4-year transition, and January 1st, everyone will have to have the insurance as the government defines it, or they'll have to pay a fine to the IRS, as you mentioned, a tax penalty. And on top of that are all kinds of regulations of health insurance, certain mandated benefits, what insurance has to cover, and who it has to cover, and how much it can charge people. And Obamacare also refers to the entire bill that included things that aren't necessarily related to that reform, you know, funding for various public health research programs and so on. But the whole package was 2,801 pages. It was very controversial when it went through Congress, as I'm sure folks know. It has been controversial ever since, and it's really reached, the debate is reaching a kind of fever pitch this week in Washington, with the House voting just this morning to defund Obamacare on a funding bill, and now the Senate will be taking that bill up and debating it.
Now, defunding Obamacare, is this a good idea, or what's going on with that?
Sure. Yeah, we at the group that I work for, it's called Freedom Works. We're a national advocacy group for individual liberty and constitutionally limited government. We think that the top-down centralized approach to health reform was a mistake. We've opposed this law since the beginning, and we would very much like to see it repealed. We've not been able to get the votes in Congress for a straight repeal, but we do think it's important to stop or postpone this law as it's about to take effect for a number of reasons that I would love to go into with you. And the way to do that procedurally is to use the power of the purse. Obviously, President Obama is not interested in slowing down the implementation of this law, and the Senate Democrats, they control the Senate. They're not interested either. But the House is controlled by the Republicans, who, to a person, are opposed to this law, and they have the power to originate appropriations bills. The Constitution assigns that duty to the House. So defunding is the tool, if you will, available to opponents of the government takeover of health care to try to force a repeal or delay of this law. And so that's what they're trying to do. And that's what the debate is about right now.
Now, the biggest thing about Obamacare, obviously, is there was supposed to be a way that health care could be affordable for everybody at all financial levels for the most part. But I think the thing that people are having a hard time with is the idea that they're going to enforce the fact that you must have this. Now, look, okay, back in the day when they decided, well, everybody, by law has to have driver's insurance, auto insurance, that is.
Right.
So, you got to love the insurance companies must have just, creamed over something like this to realize now that it's a law, they had free rein to charge anything they wanted to, it seemed like. Now, with this, you kind of hear, no, that's not what's going to happen. It's kind of reining in the controls of the health care cost while giving you what you need to take care of yourself. What is the real deal with this?
Yeah, the promises made for the legislation when it was being debated 4 years ago were that, first of all, we were going to get, if not all Americans, then most Americans covered. The United States has a peculiar problem of about 15% of the population being uninsured at any given time. This is a chronic condition that the United States has, and other countries don't really have it, and it's because of the peculiar nature of our system. And so they said, well, we're going to fix that. We're going to cover the uninsured. They also said we're going to lower health care costs, and we're going to all do this in a way that is a sort of market-oriented, minimally invasive way. And I think really all those promises have proved basically false. First of all, it turns out the experts say that even if Obamacare is fully implemented on January 1st, 30 million Americans will continue to be uninsured in perpetuity. The law did not achieve the objective of universal coverage. And health insurance premiums have continued to rise at a rate faster than inflation, faster than the economy is growing, even over a time period when President Obama had said, look, if we do these reforms, every family will save $2,500 a year on their health insurance premiums on average. And so we're going in the wrong direction on health care costs. And in terms of how market-oriented the reform is, I think if you look at this law carefully, you realize there's a lot of regulation here, a lot of mandates, a lot of top-down. Really, the analysis was, well, the free market has failed, so we need to fix it. But I think they've gone in just the wrong direction. You mentioned the insurance companies. They were part of this deal. Really, this reform would not have happened except that the health insurance industry said, you know what, we'll do you a deal. If we agree that everybody is going to have to buy our product, if you make everybody buy our product, then we'll agree to be, in effect, a regulated utility. And that was
really.
Yeah. Yeah.
I don't know. There's just something. It's sort of like, the fox that had the gingerbread boy on his back crossing the pond.
Well, sure. Exactly. Exactly. You can't trust insurance companies. My view is the only thing that keeps them in check is true competition.
I agree with that 100%, actually.
Yeah. And unfortunately, we did not have good competition before this law was passed, and I don't think we're going to have it as a result of this law. We need to go in a different direction altogether. You mentioned the auto insurance. It's true that I think 47 states have required people to have auto insurance, but interestingly, even in those states, you still have 13-14% of the automobile driving public driving around uninsured. Mm-hmm. It's always the guy that I have the fender bender with that is uninsured despite the law. So to me, that's evidence that mandating that people buy insurance doesn't really solve the problem. It won't actually get people covered, but it will drive up the costs. And a better way to go is to lower costs by reducing regulation, having real competition. So one thing that we advocate at FreedomWorks is letting the insurance companies, or in a sense, making the insurance companies compete across state lines. So if I want to buy a health insurance coverage in the next state over, I can do that. I'm not limited just to the one or two big health insurers that dominate my state.
Now, it's interesting, too, Dean, is here on the program, we like to showcase what seems to be a challenge or a problem that's out there, but at the same time, what we also try to do is to reel in solutions to these problems, maybe in a very holistic way. And one of the things we were talking about just a few weeks back was single-payer health care where you actually have a relationship with the community hospital. And you pay a membership fee monthly. Everybody pays this, and they participate at this hospital, but that you're fully covered. And so you don't have to worry about an insurance middleman getting in the way and deciding what they will pay, if anything. You know, I think that's one of the biggest challenges a person has with health care, and I know I had experienced this even with my own son, with excellent coverage. Well, you know, we don't believe he needs this. And it's like, really, why don't you come and take a look at what's going on here and then tell us that, you know, and just being tied up so much. And I think even hospitals and doctors get frustrated with all this. You know, I've provided the service. We know they've paid their premiums, but you're holding back the money. And, you know, back when Obama was running for his first term, and they were trying to talk about the idea of universal coverage for everybody, and then Sarah Palin and John McCain's side was screaming, oh, they want a socialist government. You know, here were these European countries who have successfully for years given all of their citizens health care, and they're kind of scratching their heads going, what are these people talking about here in America?
Yeah, there's a couple of things there to focus on. One is the fact that the insurance companies, question is, do they serve any useful role in the system? My view is, of course they do. That's why they came into existence, but they can only be truly beneficial if, as we said before, they're subject to real competition. They have to be at the service of the patients and consumers and not be dictating medicine, you know, telling doctors how to practice medicine and so on. And so you need reforms to ensure that they do that. If you get rid of them altogether and just basically put a government bureaucracy in charge of paying for people's health care, then the government becomes basically an insurance company, a big monopoly. Mm-hmm. And how do you hold them accountable? Well, you obviously you can try to change the politicians who govern the system, and you can write an angry letter to the bureaucrat who made the decision. But it's not the same as market competition. You can't necessarily take your services elsewhere. And when you look at those other countries around the world that have national health insurance systems, they all suffer from problems that are actually in some ways very similar to the problems we experience with monopolistic insurance companies in this country. They, you maybe can't get access to a service that you want because it's been deemed too expensive, or you have to wait in line for a particularly expensive or unusual therapy because, again, resources don't admit of it. Free health care for everybody sounds great, but nothing's free. Somebody ends up, right? Somebody's got to kind of, ration it. And you can ration it by market forces, which is, in my view, the most efficient and fairest way, and ends up making sure that everybody gets more in the end. Basically, the pie grows. Or you can try to ration it top down through some kind of bureaucratic mechanism. And there I think you end up with less and plus lots of unfairnesses, like the VIPs in the government getting, to the head of the line in a rationed socialistic system. So, and what you find also in those other countries, they often have escape valves. For one thing, people can fly overseas if they really need something. Another thing, they make special exceptions, for emergencies, and they allow a private sector to kind of exist alongside the government system and so on. And so what does that tell us? I think it tells us that we have to be wary of any super simple solution that involves somebody other than you being in control of your healthcare choices and your healthcare dollar.
Now, tell us about the Sarah Hall Ingram.
Sure, that's a jump. She is a lady who works at the IRS, and in the past year or so, she was the person in charge of the unit within the IRS whose job was to approve applications for tax-exempt organizations. And her name came to the public light because that unit was engaged and admits to having been engaged in a systematic harassment, basically, of groups that are on the political right, and kind of burdening them with excessive information requests and delaying approval of their applications for months or years while other groups were getting their applications approved instantly. That's Sarah Hall Ingram on that side. But now recently she's become the head of the IRS office in charge of implementing Obamacare. She's now the top healthcare official in the IRS. And that's been of concern to those of us who are critical of the government takeover, that this person who is associated with a political targeting campaign is now also in charge of healthcare. And the IRS, if you don't know, is the most important agency after HHS in implementing Obamacare, because the tax credit subsidies for people in the government exchanges are administered by the IRS. And the exchange, basically when you go to sign up for the exchange, they're going to run a check on things like, what's your income and your employment status and your insurance status and your incarceration status and immigration status. All these things have to be kind of checked to comply with the law. And basically the IRS is running the huge data hub, the computer database that everybody will be punching into to make those checks. So the IRS will have lots of personal information about us as part of health care reform. And this woman, Sarah Hall Ingram, is in charge of that.
This just doesn't feel or sound very encouraging. Are there any solutions or any different directions that FreedomWorks has been monitoring that could help us feel that there may be a better direction to go?
Yes. Yeah, there is a better way, and the way is more freedom for individuals, not less, more choice. Markets work in healthcare. And this is the first thing people have to sort of understand is, yes, markets do work in healthcare. Now, do you want, in an emergency room situation, to have to negotiate a price with, the surgeon? No. Nobody thinks that's reasonable. And that's part of the reason you buy insurance. You have a backup that's where the price is already negotiated. But when you go into the urgent care clinic or the doctor's office with a non-emergency complaint, if you knew the price in advance and if you knew what other people are charging, you could exercise a little consumer freedom. And in those places where that actually goes on, sure enough, prices go down, quality goes up. And I can give you several examples on that if you want. But
sure.
Okay. Well, for example, in Florida, there's a network of urgent care clinics called CareSpot, and what they decided to do was basically publish their prices. It's like a McDonald's. You walk in and it'll tell you a X-ray $75, a broken leg $250, and what have you. And it's obviously they're not a hospital. They're there for certain things, but they are doing very well because people find that it's quicker than the emergency room and less expensive, and it's less expensive than a doctor's office for those procedures and therapies, and it's competition. Another example, in Oklahoma City, a surgical center, which does, kind of real surgery, like joint replacements and so on, they decided to just publish their prices. And this is unheard of in healthcare because normally, like if you go to the doctor's office and you ask, hey, doc, how much will this cost? He can't tell you the answer because it depends. He doesn't know.
Right.
It depends on your insurance plan.
Right.
And he doesn't know that. So, but in this surgical center, they just said, look, if we do, a knee replacement, it's going to be X $1,000. And that forced the hospitals in the area that compete with that surgery center to publish their prices as well. And some of them didn't know what their price was. They had to kind of figure it out. And then some of them published prices that were very high, not competitive. And then what has happened is you've had a kind of a downward pressure on the prices because consumers are going for the, what appears to be the more efficient service. And so these are examples, and more examples. Laser eye surgery has never been covered by insurance. As a result, people pay out of pocket, and it tends to be very competitive and efficient. Prices go down constantly. Quality goes up constantly. Another is cosmetic surgery, same thing. So these are examples of how markets work in healthcare, and what FreedomWorks and folks like us who are critics of the President's health reform law are saying is, let's have more of that. let's have more freedom, choice, and competition, and you will see good things happening. And there are reforms that you have to undertake to make that happen. And if you want, I can go through some of those reforms.
Please do.
Sure. Well, for one thing, folks should be, if possible, they should own their own insurance and be able to take it with them from job to job and not lose it when they change jobs. That right now we have job lock, and our insurance isn't portable because the tax code has distorted the health system so that most people get their insurance benefits at work, but they don't own those benefits. Your employer owns them, and that's why you lose them. If you owned your own insurance, then you could, for example, you could negotiate with the insurer and you say, I want a higher deductible. I want to pay less on premiums. I'll cover a little more out of my own pocket, and so on. And each person could tailor it to their own needs. If you had that, insurance companies would be less intrusive because probably more people would be paying a little more out of pocket. And that's how it used to be in the old days. The insurance companies really didn't want to be meddling in medical decisions because they knew they didn't have the expertise. They just wanted to pay bills when they came due, and they wanted to protect themselves from fraud and so on. And so one of the ways you do that is make sure the patient has skin in the game, pays a reasonable amount for each procedure, and so on. So you have to fix the U.S. tax code to deal with that. You need to let people, for example, deduct their medical expenses. Right now, you can't really do that. You would have to have very high medical expenses before the tax code will allow you to deduct any of them. I think 10% of your income has to go to medical expenses before they'll let you deduct any of them. We're saying let people deduct all of their medical expenses. And by doing that, you help to level the playing field with the employer health benefits. And some people, what will happen is some people say, you know what, I don't know that I need a coverage from my job. I'll just go ahead and buy an economical health plan on my own, and I'll deduct the premiums. And so this may sound a little bit complicated, but that's because our health system is complicated. But the principle is get people in charge of their own health care. Some other ideas: make the insurers compete across state lines, as I mentioned before, more competition between insurers. Let people opt out of Medicare. This is something nobody's ever heard of, but it's a true fact that if you are in Medicare, you have no alternatives. You can't drop out of it. You can't disenroll and buy a private plan or rely on your own savings. If you do, the government will deprive you of your Social Security. In fact, they will actually make you repay any Social Security you've received to date. So there is effectively a mandate in Medicare, just like the one in Obamacare. We say get rid of that. Make Medicare compete with private insurers, just like, but you want competition everywhere, including in that area. By the way, it occurs to me, if some of your listeners are Medicare recipients or soon to be, they should just be aware that Obamacare does not directly affect them. They don't have to go into the exchanges. The exchanges are for people under 65. That's just for those who might be a little confused.
So, Dean, tell our listeners, if you could, if they want to be involved in this to get better information so they can make better choices about whether or not this should be allowed to continue or to get rid of it, and let's find other solutions. Obviously, you provided some good reasons as to why this isn't or doesn't sound like a great deal for anybody. Where can they go?
Well, we would suggest, first of all, getting more informed about the health care law and the fight over it at our website, freedomworks.org. And there's also a number of other great resources out there. I'm thinking of Americans for Tax Reform, which will tell you all about the tax hikes in Obamacare. And I would say try to follow what's happening in Washington this week, because there could end up being some kind of deal or compromise that will affect the future of the health reform. And again, our website's probably a good place to get updates on that. Freedomworks.org.
Very good. Well, Dean, thank you for joining us here on the Beyond 50 radio program. At times I just find that people are so misinformed, and then they complain when the outcome isn't, favorable, let's say. And you have to say, well, what steps did you take? What action did you take? Where did you get your information? Why didn't you look into it a little deeper? That's why we are where we are at times. And,
sure.
And it's all about, them taking the proper steps. Through FreedomWorks is one, or there was the other one, which was the American tax. What was the tax?
Americans for Tax Reform.
Americans for Tax Reform. Look into this stuff. Take time and quit allowing the cable television to wash over you as slowly this large body begins to take over, and then you lose all of your choices. And find out more about that. Thank you so much for joining us here on the Beyond 50 radio program.
My pleasure.
So there you go, citizens of the world. Find out more by getting actively involved, and that's how you can find out about that. You can also go to Beyond 50 Radio and visit our blog spot, where we're going to post some information where you can find out more about this. We thank you for tuning in. I'm Daniel Davis. This is the Beyond 50 Radio program, and remember, live your day past halfway.